Hello, and welcome to my podcast, Good Grief. My name is Dr. Christine Malone, and in this podcast, we talk about trauma, tragedy, and survival. In each episode, I will interview someone that has gone through grief in some way, and we will discuss the impact it has had on their life. By sharing these stories, we hope that others won't feel alone should they be going through similar situations. Enjoy.
Okay, listeners, thank you so much for joining me for this podcast. My guest today is going to talk about his life and struggles. He is a cancer survivor and author. So, guest, if you would introduce yourself and just kind of give us a background on when you were diagnosed and kind of the story of how this came about.
Yeah, right. Well, thanks a lot for having me on. This is great. I appreciate the opportunity to tell the story and try and do my best to help all the cancer patients behind me. So my story, I had a tumor probably about the size of an egg on the back of my leg, kind of right above my hamstring. Didn't hurt, didn't really bother me too much, but it kept growing. And, as a responsible person, I waited probably way too long to go see my general practitioner. So I went to see him. He promptly sent me down to the local cancer hospital. And at that point, I was starting to put two and two together. But I was put into a surgeon, oncology surgeon, and they tried to do what's called a needle aspiration, which if you're squeamish, don't listen, but they essentially stick a needle right into the tumor to gather some cells to see what it is. So I had that process done. My wife almost passed out during it, and the results came back inconclusive. So they decided to have surgery to go take a look at what was in there. So the approach was, if they could get a good biopsy and a good result, if it was cancer, they would take the tumor and some extra tissue out, and if they didn't know what it was, they would just sew me back up. Well, the latter happened. So they opened me up, they took a sample, they sent it down to pathology. Pathology said, we don't really know what this is. And they sewed me back up. So when I went to see the surgeon for a follow-up visit, he said something to me, which at that point I knew I was in trouble. He said, well, we may not take the tumor out. We may just let the medicine take care of it. Now, I'm no medical genius, but I knew at that point that he was referring to some course of chemo to try and shrink this, or some other kind of intervention to shrink this tumor. But they didn't have a full diagnosis at the time. So fast forward, they had met with a couple other doctors in the hospital, and they decided it was cancer, and they decided it was peripheral T-cell lymphoma, which is a pretty rare cancer to begin with. And then my presentation was even more unique. So they went back in, another surgery, took the whole tumor out, and then decided that I needed chemo, and then subsequent to that, radiation. So it was quite an adventure. And it's an interesting story. I've talked to a lot of other people that have been diagnosed, and for me, I kind of knew it was coming, but I think for other people, it's just kind of an out of the blue shock. So I kind of knew where this was headed, but once they tell you exactly what it is, then you can look up how bad it is, and then they tell you what they have to do about it, which in my case was several rounds of 4 days at a time, inpatient chemo. Then it becomes real, and that's when your head starts to spin. So that's kind of how I landed on the doorstep of the hospital for my initial round of treatments as a cancer patient.
So let me ask you a couple of clarifying questions. I also had a cancer diagnosis a couple of years ago, breast cancer. Mine was stage 1. It hadn't spread anywhere other than one lymph node. So I had surgery to remove the tumor and the lymph node. So was your cancer, I'm not familiar with the type of it. Is it something that already has spread somewhere, or was it by getting the tumor out, were they able to encapsulate that? Or how does that particular type of cancer actually work?
Yeah, so it's essentially a blood cancer, right? And the way it showed up was in the form of this tumor. So they that's why everybody was kind of stumped, because it wasn't like the presentation wasn't like what they normally see. So I think that's what drove the extra trips to the OR and the extra trips to get some tumor samples. So and they, they did a great job. I got to give them a ton of credit, because they did come up with the right answer. At one point, they sent the tumor off to the NIH, and they confirmed the diagnosis probably about a year after I was done with treatment. So
One other thing I don't think I asked you is when was all this happening? When was this the tumor and all that showing up? What timeline was this?
yeah, so this was, what is it, 2015. So kind of in the fall, I started this process, and I found out exactly what it was after the second surgery, the day before Thanksgiving. So that's when I found out what was ahead of me in terms of the chemo visits and the radiation.
So with the treatment you had, is your cancer in remission? Is it cured? Is it what is the status right now?
Yeah, it is. So they just cleared me late last year. So I'm off of the kind of checkup regimen, and as far as they're concerned, I'm in remission. So it's been amazing.
Congratulations. I know that word sounds amazing to those of us who've had cancer. And you're in
Yeah.
remission. It's like, yes, that's what I want to
Yeah.
hear. Yeah. So tell me a little bit about, I mean, I can only imagine, you sound like a very young person. I can only imagine kind of the trauma that would have in my head where I'm all of a sudden given this diagnosis. How did you cope with that? I mean, you mentioned your wife. Was there, certain things that you were able to do or not do that you think were helpful to you to kind of get through those sessions, those treatments, which I know are absolutely just take the life out of you, if you will,
Yeah.
for those treatments. Again, kind of how did that all work for you to get you through those phases?
Yeah, so first of all, my wife she's been amazing, and was my rock pretty much all the way through. And I think, when you're first told of what has to happen, it's bad. You start thinking a lot of thoughts that aren't going to be particularly helpful, and you just kind of take it like everything else that, at least in my medical experiences, you just go to the next doctor's appointment. And as I started to go through it, I was exhausted with all the process of figuring out what I had. And then when I started chemo, I had kind of worked myself up to where it's like, okay, I got this. I'm just going to go and power through it and whatever. And what happened is, the first day I was in the hospital for my inpatient chemo, I had exactly 0 chemo. There were a whole variety of tests that I had no idea were coming before they would even start anything. And for me, I got in a really bad place mentally, just from being frustrated and angry, and all sorts of things that I knew were unproductive. I just didn't know what to do about it.
Yeah, so I hear this story a lot. I know I've experienced it myself with kind of that not very good communication when it comes with the healthcare professionals to kind of let us know, what do we need to do, what do we not need to do, because
Yeah.
a lot of us are very, fact based and procedure based. Just tell me what we need to do. I'll be here. Let's do it. But to have feeling like we're losing time or we're wasting time,
Yeah.
orders could definitely be. I know, like I said, I hear this a lot. That part a lot. So how did you once you got through with the treatment? Whatever. I'm assuming you had to take time off from work and so on during
Yeah.
this time. Yeah. So how long from the diagnosis to the time the treatment ended were you actually able to sort of, be a more productive life, I guess is the word I want to use, maybe go back to work. So
Oh, yeah, I would say probably 6 months at least. And it probably took, I would say, probably at least a year for the kind of mental fuzz to
yeah,
evaporate.
yeah, no,
And it's,
yeah, I know that mental as well. Yeah.
yeah, and it's a strange thing. Like, I try and articulate it to people, and it's like you don't realize that you had it until it's gone. And because everything's kind of this slow burn where it's like you don't really feel it, right? You feel a little bit off, certainly when you're going through chemo because you're tired and whatever else. But, when you're done, you're like, oh, okay, well, everything's back to normal. I'm not going to chemo every couple of weeks. So, and then it's not until much later that you realize you're like, wow, I was really fuzzy.
Yeah, I'll speak for myself here. I was very impatient with myself in those days too, where I thought
Oh,
I should be better now. Why am I not better? And I was really
yeah.
kicking myself, wondering, what am I just weak? What's happening? And
Yeah.
really looking back, I needed to give myself a whole lot more grace than I did. And
Yeah.
I've talked to a lot of people since then who tell me the same thing. My brain doesn't work the way it used to. It's like, well, you know what?
Yeah.
Give yourself the grace and the patience, because may not completely come back totally. I mean, depending on
Yeah.
your situation. So just you're a survivor, and you're doing well. Just give yourself the courage, whatever, to get that part. So at one point in time, you decided you were going to write a book
Yeah.
about living, or how to be a cancer patient. So tell me kind of what started you down that road. You think writing a
Yeah.
book, what you wanted to do.
Yeah. So, I mean, professionally, my background, business executive, and I spent a fair amount of time in kind of operating roles as a Six Sigma, like a process improvement black belt and whatnot. And it struck me, like, first I had to get myself under control, right? So I knew that, it was kind of my first round of chemo where I had a very high dose of steroids to kind of keep some of the side effects from the chemo at bay. So I didn't sleep a lot. And I knew the first couple of days that I was in, the first day especially, I was a disaster. I mean, I was really, really not effective at managing myself. So I knew that wasn't going to be helpful, but I didn't really know what to do about it. So I kind of went to work in how I thought about things. But then, as I went through the process over the next several months, I kind of learned some things. It's just like, look, you got to do these certain things, like advocate for yourself or stay ahead of, side effects or whatever the different steps may be to be effective. And I think that those things come together. So for me, I kind of crystallize it in a statement. It's just like, look, when my children were young and they were playing soccer at 4 or 5 years old, before their first game, we're coaching them, we're giving them all these instructions and all these rules, and yet we throw people into the medical system for, and sometimes the fight of their life, with really no guidelines other than here's your next appointment. And to me, that's insane. It just makes no sense to me. So, me, I'm just like, well, look, if I can help one person, that's a win. And, the most gratifying thing is when I get, emails or letters from people and saying, hey, look, I read your book. It was just, it really helped me. And that's all for me. That's it. That just turns my wheels. I think it's amazing. So
Yeah, that's like
it's just a disconnect. I don't like it's just crazy to me. I just don't understand it. So
Well, I'm with you too. I also have a black belt in Six Sigma, so you have a few things.
yeah,
You and I have a few things in common here, and I think that might be why we're getting impatient with the systems that don't work right. So
right.
take us through kind of what is your book? How to be a cancer patient. Okay, what do I get out of that? It tells me how I should behave, what I should look for, questions I should ask. I mean, what kind of stuff are you guiding people through?
Yeah, so there's really kind of two chunks of it, right? One is how do you get your mind under control so you don't sit all day every day and wallow in all the horrible thoughts that you can generate by being a cancer patient. And I did a pretty awful job of that early on, but learn some ways to kind of turn that around, because that's really the first thing. Because if you have all this noise in your head where you can't think clearly, or at least can't think clearly enough to kind of navigate yourself through the healthcare system, you're in big trouble. I was, at least, and I think that's really the end result for most people. So kind of the first thing is learn how to get that noise under control to the point to where you can kind of lean into some of these other process things moving forward. And then some of the things I talk about, advocating for yourself. So, if you don't feel right, or things aren't going the way they should in your mind, or if there are better options for parts of your treatment. So for instance, maybe you're claustrophobic and you need to have an MRI, and the MRI tube at the local healthcare facility is really small, but you know that the hospital down the road that's in your healthcare network has a big giant one that'll make you more comfortable. Well, ask if you can go there. Right. And it turns out that there's probably, tens to hundreds of those kinds of things where, it makes your experience a little bit better, but it also reduces stress. And really that's the key, is all these things kind of hopefully bring down your stress level.
Yeah.
So
giving tips for how to advocate for yourself and how to, what questions you should even think about asking. I mean, I don't know that I would think about asking if there's a larger MRI tube. And I am claustrophobic and didn't like being in the MRI tube.
right.
Just had to like hold my
Right.
breath.
Well, I think you just got to be curious, right? I mean, I think that's the first part, and you have to be strong enough to say, I don't understand this, and it's okay. Like for me, the first day when I was in, somebody, the nurse said, "Well, here are the drugs in my chemo cocktail." I'm like, "Well, what do each one of them do?" And they gave an explanation. And I'm like, that wasn't good enough. So I'm like, I need to talk to my doctor or the pharmacist or somebody that can explain what all these things are going to do in my body. Asking for help from the nurses, asking the social worker for someone to help with a mental health challenge, right? So don't feel bad if you don't know the answers. Don't feel intimidated by someone who has an immense amount of medical training. And what I tell people is, you are the expert of you. And if you want to reduce your stress, you need to go and find out what's going on, and you need to ask for accommodations, if they're possible and reasonable, that are going to make you more comfortable and reduce your stress level.
Yeah, great suggestions. I mean, obviously, I think most of us would agree that stress only adds to the problem when we're going through a situation like that, and can most likely even lead to more health issues. So that's just a great idea. And I think I've worked in healthcare a long time. It's entirely possible for the so-called layman to come and ask those questions, and you're not offending anybody. You're not, you're not being, pushy. You're just saying, hey, is there another option for me? Because this thing, really doesn't work for me. This is really stressing me out, or
right.
do this, or I know when I was going through radiation, I asked them if they could play a different type of music. They were playing this music.
Right. Of course.
Me, and I was like, can you just play something that's a little bit more on my, or nothing, because the music was like, and I went, and they, oh, absolutely. But if I hadn't asked that, they'd keep playing whatever they were playing, and I'd have been sitting there thinking, I hate this music, right? So just those kinds of things where you step up and you can say, hey, is this a possibility? And if it's not, it's not. Right. I mean, I know a lot of healthcare, it's like, you can't do this, you can't do that. These are the rules and regulations. I get it. But there is, leeway on some of those things, especially when it comes to things that make us comfortable, right? I want a blanket, or I want this, I want that, whatever. So I think that's great. Great advice. When did your book publish? How long has it been out?
January.
January.
So
awesome.
Not too long. Yeah.
Awesome. Well, I can tell you, I just ordered it, so I'll be reading it next
came
week.
out. Well, no, I'll send it to you. You just tell me where to send it.
I just ordered it. Coming to me next week. So yeah, I can't wait. I love the whole concept behind it. So we're going to link to your book and so on when we publish this podcast. So I do want to make sure I give you a chance. So is there any advice or things that you would say to do or not to do if someone's given a diagnosis that's just kind of really scary right there? What would you say if you could change something you did or didn't do that maybe you thought, gosh, if I knew what I knew now, I would have done X? Is there anything on those lines you would share?
Yeah, I mean, I'll give one piece of advice that maybe sounds a little bit mean, but I think you and I talked about it a little bit before. There will be people that come into your life that you know a little bit, or even know well, that are the most well-meaning and well-intended people that bring you extra stress. And you should never, ever, ever feel bad to go and tell them to just take a pause and go away while you deal with this. Now, whether you do it yourself or you do it through an advocate of yours, but look, it's a time to be smart about being selfish in a nice way, because that, again, it's a way to just reduce stress, right? And you'll find people say very, what seem to be to them anyhow, very innocuous things to just set you off because of what you're going through. And it's probably irrational, but don't put yourself in that position if you don't have to. So you don't have to be mean about it, but certainly, lock yourself down to the extent that you can. And, I would even say the same thing on social media. I mean, some people find that cathartic, I think, to post their life story out there. But, again, it just invites more of these opportunities for people to say something well-meaning, well-intended, that really puts and adds stress to you. So
Yeah, no, I completely agree with you. I think there's a lot of examples that I could share, both from myself and people I've talked to, about well-meaning people. And one of the blogs I have coming out in the near future is about what to say to people who are going through a hard situation, and what to do. So, like, rather than say, well, I'm here if you need me, instead say, well, I'm going to have some food delivered. Would you prefer Indian or Mexican or whatever? So
yeah,
you're actually being more proactive rather than
right,
putting the onus on the person who's having this problem. Like, I don't want to have to solve the problem for you. Can you
right,
just, right? So don't tell me, right? So it's kind of like, I remember in my, when my son passed away, for example, where people would say, well, what can I do to help you? And I think, well, I know I have to sit down and think about it. I don't want to sit down and think about it.
yes,
Why don't you just come on over and do
yes,
my laundry? Or why don't you just come?
yes, yes,
So I think there's so many things that people don't realize they can do for
yeah,
their friend, coworker, loved one, whatever, when
yeah,
they're going through an emotional thing. And the
yeah,
practical stuff is what really is what we miss, right?
yeah,
Sending me flowers. Hey, that's nice. I'm actually not a flower loving person. So, I'd rather have you do my laundry, or send me some food,
right,
or, take my kids out so I don't have to deal with
right,
feeding them tonight or whatever. So I think those are
right,
great points for people who don't know, what should I do or say when someone tells me, hey, I just been diagnosed with cancer, right? Well, what do
yeah,
I say? Well, there is not really anything you can say. Nothing's
yeah,
you can't make it better or take it away, but you can
yeah,
actually do something helpful rather than
yeah,
put that onus on the person who's sick or grieving to tell me how I can help you. That's what really, I
yeah.
think, is hard in some cases. So yeah, I appreciate you sharing that. That's I know, kind of a pet peeve of mine with people. It's like, but why would
No,
someone do that?
it's a, yeah, it's a genius. I mean, that podcast, yeah, that is genius, because what I mentioned it in the book, is just like, look, when you're sick, you don't need another quiz question from anybody in terms of, hey, have you tried meditation? Hey, have you tried this? Hey, you don't
Natural
need,
supplements. Have you tried this supplement? It worked for my
right,
cousin.
right.
Oh,
Yeah,
yeah,
yeah.
no, yeah,
It's a
yeah,
never ending thing. And you're just like, you know what? And for me, it's just like, do this, right? If you don't like it, fine, but this is a roadmap that you can use.
yeah,
So,
yeah. No, I appreciate that, because I know, and that's, like I said, one of my things. And I know I've had a lot of classes on grief and grieving and how to work with people who are going through a hard time. And I think one of the hardest things for people on the other side is, what can I do? So sometimes they
yeah.
say stupid things, sometimes they do things that aren't helpful. And it's just, it's kind of, even in the healthcare vicinity, where even healthcare providers have had say and do things. I'm like, that really is not helpful. You just need to go away. I mean, I
Yeah.
just don't want to deal with this thing. So it's kind of like,
Yeah.
I remember when my son was very sick, I had a pediatrician who was like just devastated, and she's crying, and I'm in the exam room thinking, I'm having to comfort this pediatrician. I
Yeah.
am the parent who dealing with this thing. So it's like, you know what? No, I'm not. No. And I just kind of shut her down and
Yeah.
thought, sorry, but I don't have the
Not
energy.
helpful.
I have no energy for that. So we're done here. So that was kind of the thing. But
Uh, yeah. But it's hard for some people to do what you did in that case, honestly. I mean,
it
it
is.
takes
It
a fair
is.
amount of self-confidence and a
Yes.
fair amount of
Yep.
self-knowledge to be
So
able to go and do that.
yeah,
So
even the question, what can I do to help? I mean, a lot of people are going to search themselves to see, well, what can I help you do? Right. I'm going to find you something to do. Whereas I don't have the energy to do that right now. I don't want to tell you
right,
what to do. You figure something out and do it,
right.
or don't. But don't make
Yeah.
me come up with a task list or a
Yeah.
job description for you.
Right.
I don't, and I don't
Yep.
mean to be mean. I don't mean to be mean. I know people mean to be kind. and I know people in my life that love me have meant to be kind, but sometimes it's like, wow, that's really not very helpful. Just listen to me, or just, don't ask stupid questions. Don't say, well, what do you think you did that brought this on?
Right. Yes.
So
Yes.
kind of questions are just kind of like, I just want to like bop you upside the head and go, you know what, let's rewind that while you think about it, what you want to say. That really wasn't very
Yeah.
good.
Right.
Yeah, I think
Yeah.
both you and I could write a whole book on that. So let's collaborate someday, because I think that
Yeah.
that
No,
could
I'd
be
be all
good.
about it. I think it's great. I think it's great. So
So, well, do you have anything else you want to share with us before we end this episode?
I mean, I think the only observation that I've made is that cancer clinicians have spent years now telling us how every single cancer patient's cancer is unique, right? Everyone's a sample size of one, and from a clinical standpoint, seems to make perfect sense to me. Got it. Everyone's different, so everyone who has cancer is probably going to have a little bit of a different set of needs. However, right, I am firmly convinced that the mental challenges for pretty much every cancer patient rhyme. And the more people I talk to, the more I become convinced to that. And that's why I think some kind of guidepost, whether it's mine or someone else's, to go and manage themselves through the journey, I think is always going to be helpful.
Yeah, no, completely agree. Completely agree. Yeah, you and I are totally on the same page. So thank you again for
Yeah.
joining me for this episode. I so appreciate you sharing your story and your advice, and can't wait to read your book. So,
Yeah. Well, thank you for having me. I appreciate the time, and I'm sure we'll catch up soon.
okay. Thank you for listening to this episode of Good Grief. To hear more about my personal story, please pick up a copy of my book, The Day I Became the Spider Killer, a memoir of trauma, tragedy, and survival, available in paperback, Kindle, and Audible via Amazon, Barnes & Noble, and other online book retailers.